Hello. In this video, I'm going to highlight how to adjust the flex cushion for hip flexion limitations. Hip flexion limitations mean the knee cannot be raised to the level of the hip. This can be due to muscle tone, muscle contractures, pain, or joint restrictions. Forcing the hip to bend on a standard wheelchair surface creates secondary postural deformities, as I'm now going to try and demonstrate. The wheelchair user may present with discomfort, they may present with pelvic rotation, they may present with a hip obliquity and potential pain if they're unable to raise their knee sufficiently and we're forcing them to do that. The flex cushion is designed to create a stable and comfortable seat foundation for the wheelchair user, with hip flexion asymmetry and/or limitations. It allows for quick on-the-spot adjustment by adjusting the strategic positioning base. A key feature of our flex cushion is to promote improved contact and weight distribution through both ischial tuberosities of the pelvis to allow for greater acceptance of the base of support. This simply means that sitting and maintaining contact and support along the full length of the pelvis and the back of each of the thighs on the primary support surface is possible. This means it also allows for improved upper body alignment and functioning. You can see that not accommodating non-correctable hip flexion limitations will result in rotation of the pelvis, obliquity where one side of the pelvis is lifted in comparison to the other, and this in turn will cause twisting in the trunk and spine and therefore contribute towards a scoliosis. To accommodate hip flexion limitations, we can use the flex cushion to raise the pelvis and lower the thighs to open up the hip angle, to accommodate the wheelchair user's limitations. This will allow for a more neutral spine, neck, and head alignment. This also avoids the need for a back support recline, which can contribute to neck flexion and kyphosis postural deformities that can develop long term. To accommodate hip flexion limitations, we want to lower one of the thigh support legs of our flex cushion underneath the affected leg. Remove the wedges under the cushion to the required amount. Replace the covers and assess that contact is possible throughout the length of the thighs and across the pelvis. If you need to adjust the other leg for stability by either raising or lowering it, this can be done also. Once a stable position is achieved, secure the covers. You can look at another video for this. We also recommend an anterior pelvic positioning belt to support the pelvis location on the cushion and to ensure stability. Tilt is recommended in the wheelchair base to support with pressure management needs, in which case a headrest will also need to be required for minimum effort and optimized alignment in a tilted position. The strategic positioning base is simple to use yet highly effective to ensure wheelchair users are sitting according to their correct clinical evaluation, whilst bringing comfort, increasing sitting tolerance, and decreasing pain. Thank you for watching.